Today we're here to thank Senator Casey for all of the work he's done in protecting and strengthening Medicaid for Pennsylvanians. And we're also here to remind him that during these tough budget talks, it's most important that Medicaid remains protected from cuts. Over 2 million Pennsylvanians use Medicaid and rely on that program. We need to make sure it's there for them.
And what group is this that we're here today with?
Pennsylvania Health Access Network is who I work for, but Fight for Philly is here today. Seiu Healthcare PA is here today. The Arc of Philadelphia, Visions for Equality, Public Citizens for Children and Youth, United Healthcare Workers, UFCW 1776, the Philadelphia Council of AFL-CIO, Fight for Philly, Neighborhood Network. So many more groups are with us today.
And if somebody wanted to get in touch with you about this issue, how would they contact you?
Folks should feel free to send me an email and I will respond personally. My email address is aford@pahealthaccess.org, and I look forward to hearing from people.
So I met you like a couple years ago before this healthcare fight down at 30th Street. We were down holding our signs there. Can you tell me, like, do you think they're really going to cut Medicaid? Is it really on the chopping blocks right now?
We're actually very concerned. For the first time, it seems like Medicaid might really be on the table for cuts, and that's very dangerous. Medicaid's an extremely efficient program, so when it's cut, what ends up happening is that it's the services and benefits that get cut.
Thank you.
And I'm down here rallying, letting them know, do not mess with my Medicare. It's my Medicare, and I need it now. We need this health care thing. You know, we got all these people down here. You got poor people down here. You got people need Medicare. You got people without insurance. You know, and it's bad. You know, it's just hard out here. It's rough out here. You know, you got to have a heart. You know, my God, don't be like that. You know, you got people out here that really, really need that. They're struggling. Times is hard. I'm quite sure you have other issues to get with besides messing with the people on Medicaid to try to make it, you know.
So you're on Medicaid?
Yes, I am.
Okay, so this would affect you if they were to cut it?
Yes, it will. Yeah. It most definitely will.
And your name is?
My name is Shelton.
I am here today because in my job, I work with families all day whose lives would not be possible without Medicaid. Their kids would not be able to grow and thrive. They would not be able to attend school and learn. They would lose their homes. And because personally in my own life, my mother worked all her life for a company and thought she had a pension. And when she retired, her pension was disappeared as the robber barons seemed to think it's okay to break that promise. And now she has nothing and is relying on Medicaid and Medicare for the many, many health concerns that she is facing and has no other way to meet. And I know that it will be me and not very long from now. And if we don't act now to save these safety nets, they will be gone. There are many, many greedy people out there, and they're not willing to let go of a nickel for those of us who need it the most.
Right. So your mom worked and had a pension, and then they took the pension away?
They took the pension away.
Wow.
Happens to people all over the place.
Wow, but that's what we've been working for our retirement.
That's right.
We don't work for today.
She thought she was all set, and now she has nothing.
That's sad. That's really sad.
Can we just make it so that the sidewalk's clear? Folks can line up on this end here or against the wall over here, but we just need to keep the pass-through clear.
Can you go both ways till they clear our Medicaid?
Awesome. Medicaid's under attack, what do we do?
Stand up, fight back!
Medicaid's under attack, what do we do?
Stand up, fight back!
Medicaid's under attack, what do we do?
Stand up, fight back!
Medicaid's under attack, what do we do?
Stand up, fight back!
Medicaid's under attack, what do we do?
Stand up, fight back!
That's right. Sometimes fighting back also means letting people know we have your back. And that's what we're doing today. Senator Casey has long been a champion when it comes to children, working families, people with disabilities, and the elderly in Pennsylvania. But he needs to know that we're not taking his support for granted, that we're continuing to hold him to his promise to look out for us and to look out for Medicaid. It's scary stuff going on in D.C. right now. Medicaid is actually on the table for cuts.
Boo! No cuts!
No cuts. There's no doubt that folks need to come together and come up with a solution and solve this crisis, but we need to do that by raising revenue. We need to do that by creating jobs. We don't need to do that by taking health care away from the elderly or from people with disabilities or from children or working families or pregnant women.
That's right. Tax the rich! Tax the rich!
Tax the rich!
Tax the rich!
Tax the rich!
Tax the rich!
Tax the rich!
Tax the rich!
Tax the rich!
And protect Medicaid! Protect Medicaid!
Protect Medicaid! Protect Medicaid!
This is not something we can compromise on. Medicaid is an extremely efficient program. 96% of all Medicaid spending gets spent on actual care, not overhead, not fat, not corporate bonuses. It gets spent on actual care, which means that when we cut Medicaid, we're actually cutting the benefits, we're cutting the services, we're cutting the pay for the workers who look out for our seniors. We need to make sure that these are the people we're taking care of right now, most of all. Medicaid matters to real people. It matters to people like Robert Choice, and I'm so proud that he's going to come up here and tell you why it matters to him. Thanks for joining us, Robert.
Good afternoon.
Good
I'm
afternoon.
glad to see so many out here today. I'm glad to be invited out here today. The main of them here, I've worked 30 or 40 years, okay? I paid into Medicaid, okay? So I feel that I'm entitled to it.
That's right. That's right.
Now, in order for me to keep my entitlement and to keep my health up and to take care of my family, I need Medicaid. Okay? Case I don't see him out here, but I voted for you. My group voted for you, and we expect you to keep up your promises that you made.
That's right.
All right. So far, you've been doing okay. I just hope you keep on doing okay. Don't let us down.
Good.
Woo! Thank you.
All right.
Thank you.
Robert, good job, Robert. Good job.
There are 2 million people like Robert that depend on Medicaid in Pennsylvania. A lot of those folks sent us thank you letters that we're going to deliver today to Senator Casey. A lot more of those people wanted to be here today, but the thing about those folks is that a lot of them work multiple jobs and couldn't be here. So I also received a lot of very touching emails letting me know why Medicaid matters to them and how much they wanted to say thank you to everybody that was going to come out and stand up for them. So thank you. And I've got a nice list. It's a pretty powerful group of folks I want to thank today. I want to thank Fight for Philly, the Philadelphia Unemployment Project, SEIU Healthcare PA. I also see SEIU 32BJ here today. Neighborhood Networks, the ARC of Philadelphia Maternity Care Coalition is here today, so is Vision for Equality, Philadelphia Council of AFL-CIO, Public Citizens for Children and Youth, MoveOn Philadelphia, Child Space CDI, the Alliance for Retired Americans, United Healthcare Workers Union, Healthy Philadelphia, Keystone Progress, Penn Action, Philly for Change, UFCW 1776, OFA Center City West. Am I forgetting anybody? Resources for Human Development, thank you. And 1199C. All right, great. So I want to ask, is Jeannie in the crowd right now? Hi, Jeannie. Hello. Will you come up and just let us know why Medicaid's important to you? Yeah.
My name is Seiu. The reason why Medicare is so important to me is because I have major disabilities. I may not look like I have a major disability, but I have a major disability. I have mild retardation. I have a problem with my leg. I have a problem with diabetes, and I need stuff to be. I need Medicaid and Medicare to support people with disabilities. Not even, all people with disabilities need to be taken care of. Not just the rich people, but it's time for Governor Casey to take care of all people with disabilities.
Right. You said it.
all means all. Not just some.
That's right.
Not just for rich people. All means all. Thank you.
Yeah, Jeannie, let's hear it again for Jeannie. Thank you, Jeannie. So I think it's important to recognize, too, that when Medicaid helps individuals, and it's also that healthcare workers rely on those Medicaid dollars. 8 out of 10 nursing homes in Pennsylvania rely on Medicaid dollars to stay open, and the majority of home healthcare workers rely on those dollars to keep their jobs too. I want to invite up Katie Sipp from Seiu Healthcare PA to talk to us about that.
All right, thanks folks. So we really want to thank Senator Casey for standing with us to defend Medicaid, and obviously also are interested in protecting Medicare for the future as well. Just to give you a sense, a 5% cut in the Medicaid budget in the state of Pennsylvania would cost us over 12,000 jobs. So as Athena pointed out, you know, Medicaid is a program that is very efficient in terms of a government service. How many people in this crowd brushed their teeth this morning when they got up? I hope I'm going to see everybody's hand. If not, we know who not to stand next to. But just to give you a sense of what does it mean if a nursing home loses funding, or if home health aides don't get the number of hours that they need to do in order to provide service for their client, it's really about whether or not residents in nursing homes or folks who need assistance with, you know, activities of daily living get their teeth brushed twice a day. So what we're talking about, frankly, is do guys like Warren Buffett, do less than 2% of the people in the state of Pennsylvania pay a little bit more in taxes so that all of us at the time that we end up either needing help at home or needing help by living in a nursing home get to have our teeth brushed every day?
Yes.
I don't know about you, but I'm ready to tax Warren Buffett to make
Yes.
sure that
Yes.
all of the elderly
Yes.
get that service. Thank you.
Thank you. Actually, as I mentioned, we're collected and Fight for Philly, Seiu Healthcare PA, Philadelphia Unemployment Project, and FAN, and a bunch of others work to collect thank you notes to the senator. One of them that came from Seiu Healthcare PA, I'm just going to read quickly. It says, "Dear Senator Casey, thank you for standing up for working families as a senator. Now we need you to take a strong stand for Medicaid and prevent any cuts as our nation faces the fiscal cliff. Medicaid's important to me because I work in a nursing home. I'm a CNA. I've been working as a CNA for 21 years. I love my residents. They need the care. If Medicaid is cut, I don't have a job and the residents don't get the care. My brother's also a resident in a nursing home, so please, Senator Casey, continue to help."
Amen.
Thank you. I want to also invite Aaron Cusack from Maternity Care Coalition to come up here and remind us half of all births in this state are funded by Medicaid dollars. We need to be looking out for pregnant women and for young families.
Thank you. I'm here today to speak on behalf of all the pregnant women and families who are able to get the health care they need because Medicaid exists. And I'm also here to speak on behalf of the over 6,000 families we serve every year in southeastern PA. Medicaid should really be called mommy care or baby care because that's what it is. It provides critical health care to Pennsylvania's most vulnerable populations, including pregnant women and babies. It covers 35% of all children and nearly half of all births, including providing care to sick infants. What does Medicaid mean for pregnant women? It means Stephanie will be able to get prenatal vitamins and supplements at a critical time when her and her baby are growing. It means Christina will be able to get an ultrasound without having to worry how she's going to pay for it. It means Lanice will be able to get access to prenatal care and not have to show up for the first time to deliver her baby in the emergency room. It means that all of these women's babies will have the best possible health care available to them to ensure their babies have a healthy start in their life. We are thankful to Senator Casey for his continued support for Medicaid funding and pregnant women, especially now during the budget debates. It's an indispensable program, and when it comes to the federal budget, we must take Senator Casey's lead and always put the health of moms, babies, and families first. Thank you.